So there's kind of been a rebirth a little bit in heart failure. I think in the late 1990s, ACE inhibitors, angiotensin receptor blockers, beta blockers, spironolactone, those drugs are really kind of coming online as being medications that help stabilize heart function and really help people stay out of the hospital and live longer. And then there was a period of almost a decade from 2004 to 2015 where there were almost no new drugs for heart failure that were approved, and actually a lot of negative trials. And so in the last couple of years, we have sacubitril valsartan, which is a new drug, as well as ivabradine, which is a new drug that's been approved. We have really seen left ventricular assist devices, or partial artificial hearts, become more mainstream for a larger portion of the population. Some of the pacing devices for left ventricular pacing have improved, and then we have cardiac rehab that was just approved by Medicare and other health insurance agencies. So there's kind of been an increase in the number of therapies that we have available to offer people, and there are a number that are online that that I think may kind of become part of what we do as well. In addition to all that, there have been some policy changes. You know, heart failure is a chronic disease. There's been a lot of focus through the ACA and other legislation to really try and do a better job around chronic care. One of which is the 30-day hospitalization outcome metric, to try and make sure that transitions of care are good and that people with chronic disease really have outpatient ambulatory support structures necessary to keep people out of the hospital and stable. So it's kind of all kinds of exciting things going on in heart failure right now. And then lastly, you know, for many people with heart failure, eventually they will succumb to their disease. And so there's been an increasing, I think, push to really think about how to integrate palliative care into heart failure. And it's a challenge because heart failure is not the same as metastatic cancer, where a lot of the models were developed. And so in our late-breaking trials that will happen this afternoon, there are actually two studies around using palliative care interventions in heart failure to kind of hopefully improve patient experience and outcomes, particularly at end of life. So those are just some of the exciting things coming out of the meeting.